Hello everyone, this is Khan Gul Sabha from Ramniranjan Jhunjhunwala College and I will be talk about bone fracture. A bone fracture is the medical term used when a bone is cracked or broken. Any bone fracture require prompt treatment and should be examined by a medical professional. A doctor can realign and set a broken bone to let it heal properly. Improper healing of fracture can result in a misaligned bone or an infection. Going without treatment can also cause permanent damage to nerves or muscle tissue. Bone fractures can be described by several terms. A fracture can be opened or closed. These can also be called compound or simple fractures respectively. An open fracture is one in which the bone breaks through the skin or a deep wound exposes the bone. Meanwhile, a closed fracture does not break the skin. It must be noted that, by definition, an open fracture is infected. Therefore, it is important to get medical care immediately. Fractures can also be partial or complete, which is exactly what it sounds like. A partial fracture is an incomplete break, while a complete fracture means the bone is separated into two pieces. A partial fracture are less serious and typically you will just need a splint or a cast. Complete fracture can be further classified according to the position of the breakage as transverse, oblique, comminuted or longitudinal. A transverse fracture is one in which the break is straight across the bone perpendicular to its long axis. An oblique fracture is one where the break is diagonal. A comminuted fracture is one in which the bone breaks into more than two pieces and typically occur due to severe accident. And a longitudinal fracture is one where the break is along the bone's long axis. Fractures can also be stable or displaced. With a stable fracture, which is also called a non-displaced fracture, the bone's broken ends line up. They have not shifted out of place. However, with a displaced fracture, there is a gap between the broken end, and repair may require surgery. Typically, bone fracture result from strong forces such as falls. Fractures can result from medical conditions that weaken bone. Conditions such as osteoporosis, some cancer, brittle bone diseases. Fracture which occur as a result of medical conditions are known as pathological fracture. The older we get, the less force our bones can withstand. For women, calcium regulation becomes more difficult after menopause, since there is a drop in estrogen which regulates a woman's calcium. Children bones are more elastic, so fracture tend to be different. A green stick fracture occur almost exclusively in children. This occur because children bones are soft and flexible and able to bend more than adult bone, so they can break easily. Children are also more likely to get torus or buccal fracture, in which the bone buckle rather than break. Depending on the fracture's location and severity, symptoms may include pain, bruising, swelling, and bleeding. The individual may be unable to put weight on the injury or move the area. Now, complications. Complications of a bone fracture can include malunion, that is, fracture healed in a wrong position. In the case of an open fracture, an individual can develop chronic osteomyelitis, that is, persistent infection of a bone or bone marrow. Another potential complication is a avascular necrosis, that is, bone death. This occurs when a bone loses its blood supply and dies. In children, a fracture affecting a growth plate can result in a deformity.